Okay, we're here with Sandy Fisher, and Sandy just went through our spinal decompression program here today, right? And tell me a little bit about the symptoms you came in here with.
Well, when I first came in, I couldn't really walk. It was difficult. I had pain in my right hip that wrapped around my back and my front, like into the groin area and down my thigh.
If you were to scale that from like 0 to 10, how bad was it?
It was a 10.
Okay.
And it was always in pain. It like never ever went away. And the pain sat, the way I would describe it to the doctor, right on my hip bone.
Mm-hmm.
And, well, I'd been to other doctors where we lived because I'm a summer resident in Avalon. And I went to different orthopedists from large groups, very good hospitals, MDs, and they could never find anything. You know, they would say, oh, it's a nerve poking a disc, but I'd walk out and nothing would be done. And then what they did was they gave me cortisone shots, which was a temporary relief. It would wear off and would hurt like heck again.
Mm-hmm.
So it started impeding in my life. I used to be really active. I played team tennis. I swam. I never ran, although I have dreams of myself running. I keep dreaming. But I used to walk. I mean, I used to do stuff. I was always active. And all I would want to do is sit or lay on the couch. And all I did was complain. I got so sick of hearing myself complain that I can only imagine what others thought. My grandsons, who are 3 and 4, would walk around and hold their hip and go, "Oy, my hip, my back." So I knew I had to do something, but I really didn't know where to turn to. So out of desperation, I went on the internet, looked up different chiropractors that were, you know, somewhat local to where we live. I saw Dr. Olivieri's site, decided he should be good because I actually used his brother to build our home, so there was name recognition. And it was called Dumb Luck that I walked into this office, because from the minute I walked in, they started treating me. They did numerous x-rays. Nobody else had ever done that. And he actually showed me the x-ray so I could see with my own eyes how screwed up I was for me. Everybody here is really nice. And he just started doing stuff, and within, I mean, they kept telling me it would take numerous visits, but I think within 3 visits I started feeling better.
What were some of the procedures that they did here?
Well, you come in and they put you on this table. I call it the rack. I think it's like a decompression table. It pulls your spine, and it keeps increasing with each visit. The first visit I could feel the difference. You felt like, oh yeah, wait a minute, I'm not all scrunched up inside of me. And now I'm at the point where I'm on the highest or pull or heaviest pull, and it feels good.
Were they giving you any exercises?
Yep, after that you went to the stim, which was like massage. Then you saw the doctor, and he would always ask you how you're doing, your pain level, does it hurt anywhere else, this, that, and the other. Then you went to their physical therapy area where they showed you different exercises, and they actually work with you one-on-one, so you're not doing it wrong, thinking you're doing it right. And I bought some of their stuff, like the Big Ball and BioFreeze, which truthfully I haven't had to use. It's sitting on the counter. And I don't know how many visits I'm in, but I know that I pretty much am done, I believe, like the very end of August. And I told the doctor the other day, I feel 100%. And he said, well, you can't feel 100%. You're not done yet. And I went, well, knock wood, I feel good.
Yeah. You know, hopefully your symptoms get better before you're totally healed with this, but you've been very compliant. That's a huge...
Yeah, they said you should come 3 times a week, which I have every week except one, because we had to go home, but I came twice that week. I do everything at home.
How has this changed your life?
I'm happier. I'm actually eating a little less, which hopefully I'll eat a lot less. You just don't walk around miserable. You know, you can actually get up and do something. We started riding bikes again. I can play with our grandchildren, and they don't hear me complaining, so they're not walking around holding their back. It just, It's improved it.
Great, fantastic. Sandy, thank you very much for sharing that with me and allowing you to get videotape with us today. Really appreciate it.
If you hurt, you should come here. That's it. Bottom line.
Great, thank you very, very, very much.
You're welcome.
I appreciate it. Thanks.